Hey, it's Calvin with PlanFit, and today I'm going to be talking about Medicare penalties and how to avoid them. And I've put a lot of thought into this video because it is very painful for me to see people with Medicare penalties. I have been helping people with Medicare for over 14 years, and when I find people that have penalties with Medicare, usually it was a simple mistake, a simple misunderstanding, and it leads to a penalty that lasts, in many cases, a lifetime. So if this video can help one person to avoid Medicare penalties, I will be satisfied. I'll be very happy because it's just completely avoidable. Now, there are approximately 64 million people that have Medicare, and there's 64 million unique situations. So the things I'm going to share with you today are the big items. But it's not everything. Every situation is unique. And what's right for you isn't right for someone else. And what fits for you doesn't fit for someone else. So we have to make sure that the plan is right for you. That's why we call it PlanFit. But I'm going to hit the big buckets, the big things that you need to be aware of to avoid the major penalties with Medicare. So there are 3 areas where you can get a penalty from Medicare. You can get a penalty for Medicare Part A, which is for hospitalization. You can get a penalty for Medicare Part B, which is your medical coverage. And you could get a penalty for Medicare Part D, which is your prescription drug coverage. Each of these have their unique penalties and unique issues, so I'm going to tackle each one. But first, I want to tell you that the Medicare Part A penalties, they're pretty rare and pretty uncommon. Medicare Part B penalties, well, they're much more common, and Medicare Part D prescription drug penalties are probably the most common. Now, I don't have hard numbers on this, except for Part B. I can tell you that with the Part B penalty, there are, according to AARP, 780,000 people that have a Medicare Part B penalty. That's according to AARP. I did some research and could not find numbers on Part A penalties and Part D penalties, but I can tell you anecdotally that over 14 years of experience, we've helped a lot of people. And I have personally sat at the table with a lot of people and found that there are far more people that have a penalty for Part D than have a penalty for Part B. Part D being the drug coverage. So with that anecdotal information, I feel like I can say that there are millions of people that have penalties for Medicare. Now, why on earth is Medicare giving you a penalty for not enrolling? If you don't enroll, you're not costing them money, right? So it might not make sense. It seems counterintuitive that Medicare would charge a penalty when you didn't enroll in the plan. But here's the reason for that. When Medicare started, they said, what if people don't sign up for Medicare until they need it? And so the healthy people don't join. And the people who are going to use doctors and hospitals who have the most need for health services, those people are the only ones that enroll, then it's going to be very, very expensive. So we need everyone to participate. If everyone is participating, then it will save money because it won't save money per se, but it will share the cost across all the people. So that's the reason for the penalties, is everyone needs to be participating so that's how insurance works, right? So that the costs can be shared. So if you aren't participating, then you're receiving a penalty. So that's what all the penalties are about. They're about participation. You need to sign up when you're eligible. You need to maintain coverage. And if you do that, you don't have anything to fear. But there are some nuances to this. So I'm going to talk about those nuances. Now, again, I can't get to the fine detail because there are so many unique situations, but I'm going to give you the big pieces that you need to know. So we're going to start with Medicare Part A, which is hospitalization. Then I'll tell you about the penalties for Part B, and then I'll tell you about the penalties which is for medical coverage. Then I'll tell you about the penalties for Part D, which is your drug coverage. I'm doing them in that order because Part A is the least applied penalty, Part B is the next most applied, and then Part D is probably the most common penalty. So we'll knock the easy one out first, Medicare Part A. Medicare Part A hospitalization, just like the others, requires that you sign up when you're eligible. As long as you do that, no penalty. But if you're eligible and you don't enroll, and you don't have a reason to not enroll that's creditable by Medicare, then you begin to get a penalty. The penalty for not enrolling is 10% increase over the Medicare Part A premium for 2 times the number of years that you weren't enrolled. So if you were supposed to be enrolled for 1 year and then you sign up, you'll have a 2-year penalty. If you were supposed to be enrolled for 2 years and then you sign up, then you'll have a 4-year penalty, and it's 10%. Now, the reason why the Medicare Part A penalty is so uncommon is because Medicare Part A is essentially free when you retire. You pay for Medicare Part A when you're working. And as long as you worked for 10 years or 40 quarters, or your spouse worked for 10 years or 40 quarters, then Medicare Part A is free. So it's really uncommon that anyone has a penalty there. But Medicare Part B, which is your medical coverage, does have a premium. It's not free. And Medicare Part B, the premium, the standard premium for 2024 is $174.70. And so sometimes people say, I'm just not going to take that right now, or they miss their window. Well, there's a penalty for Medicare Part B if you miss your window and you don't enroll when you're eligible. The penalty for Medicare Part B is a percentage. It's 10% for every year that you were not enrolled when you were eligible. So if you're eligible for Medicare Part B and you don't enroll, and 5 years go by, when you enroll at the end of the 5th year, you're going to have a 50% increase on your premium. Okay, let me give you an example of the Medicare Part B penalty. Let's say that you were eligible for Medicare, but you didn't enroll for 24 months. So that's 2 years. At the end of the 2 years you enrolled, that means that you have a penalty of 20%, 10% per year, and that's going to be added to your premium. The standard premium in 2024 is $174.70. So you're going to have a $34.94 penalty. You have to add that on. So your premium, which should have been $174.70, is going to be $209.60. So you see there's a $34+ increase on your premium. You're now going to pay that extra $34.94 for the rest of your life in addition to the premium. Now, to make matters worse, it's a percentage. So if the Part B premium goes up, then your penalty also goes up. It will always be 20% above because you waited 2 years. So do you see why that's so critical? You've got to be on time for your Part B because the penalty is a percentage. The Part B premium will increase and your penalty will also increase. Don't be in that situation. So that's the Part B penalty. The Part D penalty for the prescription drug plan has a similar feel to the Part B penalty. It is a percentage, but what's unique about this one is that it's 1% for every month that you weren't enrolled, but you should have been enrolled. So over the course of a year, it's actually a 12% penalty instead of just a 10% penalty. Okay, now let's talk about the last penalty, which is the prescription drug plan penalty or Part D penalty. This is the most common penalty that we see. This penalty works this way. You're supposed to enroll in a prescription drug plan when you're first eligible. But if you don't, so you could have Medicare Part A and B, but you forgot to get your drug plan. For every month that you don't have a drug plan, you're going to get a 1% penalty. And that will just continue to accrue month after month after month until you get a prescription drug plan, and then you'll have to start paying the penalty. So the penalty is 1% for every month that you should have had a drug plan but didn't. And that penalty is applied against the average cost of drug plans. And this is getting super complicated. But the average cost of drug plans in 2024 across the nation is $34.70. So the 1% isn't being applied to your drug plan. It's being applied to the national average. So if the national average is $34.70, then your 1% is applied to that. So if the national average for drug plans is $34.70, your percentage is based on that. Okay, so let's give an example. Let's say that you went 14 months without drug coverage and then you got your drug coverage. In that example, you're going to have a penalty of $4.86. That's 14% times $34.70, because $34.70 was the national average in 2024. Now, Medicare rounds it up to the nearest 10 cents. So your penalty, just to add a little layer of complication, is not $4.86, it's $4.90. And now whatever drug plan you choose, we're going to add the $4.90 to your premium. Now there are ways that you can get a drug plan without paying without paying a premium, essentially having a $0 premium. For example, many Medicare Advantage plans that have a $0 premium include drug coverage. So if you have a $0 premium, are you still going to have to pay your penalty of $4.90? Yes, you are. So what costs someone else $0 is going to cost you $4.90 a month. And that penalty is going to be applied for the rest of your life. Just like with Part B, we're talking lifetime penalties here. So you say, well, that's about $5 a month. How much is that going to hurt? Well, this year it's $4.90, and you have to pay that all year. Next year, if the average premium goes up, let's say the average premium goes up to $50. Well, your percentage also is based on that average premium and is going to go up. So you don't want to get caught in these situations because these penalties are variable and you will pay them for the rest of your life. We've talked about all of the different penalties, the 3 major penalties. But what if you have other coverage? What if you're still working? What if you have VA coverage? Are you going to get a penalty in those situations when you don't take Medicare? Well, the answer there again, like everything else, is it depends. It depends on if the coverage you have is creditable. Now, creditable, a lot of people will say the word credible. It's not credible, it's creditable. Creditable means that Medicare will count it as coverage and you don't have to have Medicare coverage. So you need to know if the coverage you have is creditable. So let's talk through a few scenarios to make sure that you understand what coverage is creditable and what coverage is not creditable. And I can't cover every possible scenario, but I'm going to give you some big ones. Here's the most common scenario for not taking Medicare Part A and B. I'm still working. I'm working past 65. This is becoming more and more common. More and more people are working past 65. Maybe you're working till full retirement age at 68 so you can get the full Social Security benefit. Maybe you have a job that you love. I don't know, but you're working past 65, right? So in that case, can you delay your Medicare and not get penalized? Well, the answer is it depends on the coverage you have with your employer. So every year, your employer has to send you a letter that says if the coverage is considered creditable with Medicare or not. You need to look at that and say, is this creditable coverage? If it's creditable coverage, then you can delay taking Medicare and you will not be penalized. And when you retire and you end your work plan, you can sign up for Medicare at any time because you'll have a special reason to do that. We call it a special election period. And you can go on Medicare and not be penalized. So, good scenario, right? But a lot of people find when they get eligible for Medicare that it's better to go to Medicare than to keep their work plan. A lot of times it's more economical and even gives more options and more coverage or availability of more doctors to go to Medicare oftentimes at a lower cost. So we really need to look at each situation individually and say, is it better for you to stay with your employer coverage, or is it better to go to Medicare when you're eligible at 65? And you can make either decision as long as your employer plan is creditable with Medicare for both Part B and Part D, for both the medical coverage and the drug plan coverage. Now, here's a scenario that is really dangerous, extremely dangerous. And it's the COBRA scenario. Some people say, well, I love my work plan, but I am going to quit and I'm going to COBRA my coverage. And when my COBRA runs out, then I'll join Medicare. This is a terrible scenario. As of 2024, man, I hope that this video becomes obsolete and that this doesn't matter anymore because it's such a big problem. But as of 2024, and in the entire history of Medicare, COBRA has never been creditable coverage. So if you are on COBRA and your COBRA runs out, you don't have creditable coverage. 2 major issues are happening there. Number 1, you're getting a penalty for Medicare. Number 2, you can't just sign up for Medicare whenever you want. You have to sign up within a window. And there are 3 windows that I'm going to tell you about. You missed the window. And so now you have to wait until the next window. So not only are you getting penalized, but you can't enroll until the next window. And while you're waiting, your penalty is growing. Terrible scenario, right? So this is what I tell people about COBRA, and this is a good visualization. COBRA is a snake, and it will bite you. So don't fall for the COBRA thing. Don't COBRA your coverage. You shouldn't anyway, because COBRA is very expensive and Medicare is usually quite affordable. So don't COBRA your coverage. Take Medicare. Another very common scenario is the VA coverage scenario. You're a veteran and you're retiring and you have VA coverage. Should you take Medicare or should you not? Is it creditable or is it not? Well, the answer is yes and no. VA coverage is not considered creditable for Medicare Part B medical services, but it is considered creditable for Medicare Part D drug plan services. So you could take your VA coverage and not take Medicare, but you would be accruing a penalty for Medicare Part B, but not accruing a penalty for Medicare Part D. I know. Why is this so complicated, right? But VA coverage is not creditable for Medicare Part B. We've talked through the major 3 penalties and how they're applied, what they are, a few ways to make sure you avoid them. But the message is the same all across the board. When you're eligible, you need to enroll or you'll be penalized unless you have other coverage that's creditable for Medicare. So I want to talk about one last thing. For those people who have missed their window, what do you do if you missed your window to enroll in Medicare? Well, you have to wait until the next window opens. So there are 3 windows. Window number 1 is the initial enrollment period. That's when you were eligible. So when you have your initial enrollment period, you need to enroll, unless you have creditable coverage. If you have creditable coverage, then you qualify for a special election period. And that's the window that you can open or close whenever you want. So you have coverage through your employer. It is equal or better than Medicare. So Medicare sees it as creditable. You're going to retire. You can choose when you retire, and at that point, take your Medicare. A lot of people will take their Medicare Part A, and when they retire, they'll take their Medicare Part B. Some people won't take A or B, and when they retire, they'll take their B. Every scenario, again, is individual, and that's why we have to look at it and see what's best for you. Now that we've talked about all of the different penalties and how they are applied, and the common theme that you don't get a penalty if you enroll when you're eligible, let's talk about when you can enroll. Because there are only 3 times that you can enroll for Medicare. There's when you're first eligible, there are special reasons, special election periods, and then there's the general enrollment period. So those 3 times are when you can enroll for Medicare. The first 2 is when you're doing it the right way. Usually if you have to enroll during the general enrollment period, it's because you made a mistake and now you have a penalty. So we want to avoid that. Let's talk about the first 2. Initial enrollment period is when you're initially eligible for Medicare. For most people, this will be when they're turning 65. So you're turning 65, you have your initial enrollment period. I say most people because there are people who have Medicare through disability. But you're turning 65, you have your initial enrollment period. That's when most people should enroll in Medicare. But let's say that you're working past 65 and you have good coverage that's creditable with Medicare. You could wait for a special enrollment period. That's a good example of the proper use of a special enrollment period. You wait until you're retiring and you drop your employer coverage, and that opens a special enrollment period like a window for you to enroll in Medicare Part A and B. Or you're working, you take Part A at 65, but you don't take Part B until you retire. You still get the special enrollment period, and the window opens and you can take Part B. So both of those scenarios are good, and we can help you with either one. But the general enrollment period is usually not so good. The general enrollment period is for all the people who missed their windows. They missed their initial enrollment period. They missed their special election period, and now they have to wait until Medicare says, okay, we're open. It's the general enrollment period. The window's open for everyone who missed it. That window is only in January through March of each year. So if you missed your window and it's April right now, you have to wait all the way through the year, accruing additional penalties, and then you can enroll in January. And when you enroll, your plan will take effect at the beginning of the next month. So if you enroll in January, your plan will take effect in February. So the general enrollment period is usually for people who missed their enrollment window, and they have to wait until it opens January through March. We've gone over the penalties and the most common scenarios and ways to avoid the penalties, but As I shared in the beginning, every situation is different. Every person has a unique situation. Whether it's employer coverage, VA coverage, TRICARE for life, of retirement coverage, all of these different scenarios make it super complicated. So you really have to get good advice on what to do when you're eligible for Medicare. We want to make sure that you avoid all the penalties with Medicare and that you have a plan that fits you best. So call the number on your screen or text us. That's what we're here to do, is to make things simple and make sure that you make the right choice with your Medicare.